There's some new technology that utilizes AI to determine what type of sickness or disease you have based on how you sound. It basically has you read out some text about how you feel, maybe in a positive way, and then it has you read out some text about how you feel in a negative way. And then it uses the sound of your voice, some type of vocal biomarker score. There's an algorithm the AI uses, and it gives a vocal biomarker score, and somehow this score is averaged out, and it can determine what type of sickness you have, whether you have coronary heart disease, clogged arteries, COVID, or if you're going to have coronary heart disease or going to have a heart attack. This is crazy. It sounds crazy, it sounds sci-fi, but it's pretty logical based on the AI and algorithm. It's just that there are certain inflections we don't hear with the human ear. This sound technology picks up and can determine, or makes a determination of whether you're going to have a heart attack or whether you're going to have COVID. And it seems to be pretty accurate based on the score. The first one instance of this is in Washington. They use advanced AI technology to calculate the person's risk of suffering from a heart attack just by listening to their voice. Based on the new study, researchers at the Mayo Clinic say people who have a high voice biomarker score are more than twice as likely to suffer from major heart disease problems related to clogged arteries. And this can be done remotely, folks. Basically, you can log on Zoom, Teams, whatever meeting technology you use, or you can send a recording of your voice, and the AI analyzes your voice recording or your voice live, and it makes a determination like that. You don't even have to go into the doctor, which even makes it more futuristic or sci-fi. I guess we're in the future now. Now, this doesn't mean it's going to replace doctors or anything. I guess they made that suggestion in that article, that it doesn't mean that. I didn't think about that. I didn't think along those lines. But they think, and I think too, it's a big opportunity for voice technology to be like an additional test to see what's wrong with somebody, or determine what type of treatment they need, or determine their exact type of sickness they have. In this research by the Mayo Clinic, the researchers recruited 108 patients, and they referred them for x-ray to assess the condition of their coronary arteries. The participants had to record 3 30-second voice samples using something called the Vocalist Health smartphone application. Okay, so I guess they're doing this from home. So they said during the first 2 recordings, each person read from a prepared text before speaking freely about a positive experience. For the 3rd recording, the group did the same but spoke about a negative experience. And this Vocalist Health algorithm analyzed all of the samples. And they trained this system using more than 10,000 voice recordings. And they said it's not yet ready for clinical use. Okay, but it can pick up on 80 different voice features, like the frequency, amplitude, pitch, and cadence. And the results of this linked 6 features to coronary artery disease. And they combine all these readings into a single score and express it as a number between -1 and 1. So basically, the technology uses machine learning to quantify something that's really hard to quantify with our ears and brains. But I guess the machine learns each time it does the test. So the results of this biomarker score in regards to heart disease risk, they said over 2 years, 58.3% of participants with high voice biomarker score visited a hospital for chest pains or major heart problems, including heart attacks. And then only 30.6% of those with low voice biomarker ended up going to the hospital. So this is basically, the AI basically guesses in the ballpark of whether you're going to have a heart attack as far as future predictions. So basically saying those with the high voice score were over 2 times more likely, like 2.6 times more likely to suffer from major heart problems associated with coronary artery disease. And they were also 3 times more likely to show evidence of plaque buildup in medical tests compared with those who had a low score. Now, the researchers don't know why exactly a person's voice may reveal their level of heart health. They think it might be something with the autonomic nervous system. It could be part of the puzzle. It's the part of the nervous system that regulates bodily functions that are not under a person's conscious control, like their voice, their heart, their blood pressure, that type of thing. They say the same technology has been used to predict or test a range of disorders like Parkinson's disease, Alzheimer's, and COVID as well. I'll go over the COVID research also. So, in regards to the COVID, since I mentioned it already, there's multiple labs working on algorithms that help people diagnose COVID just by the sound of their voice. The research is being done at Carnegie Mellon, Harvard, and MIT, and they're all collecting voice data to train the algorithms. So with their research, they're basically taking the vocal signatures, they call it vocal signatures, that could indicate somebody's carrying the virus. So basically, it listens to your voice and can tell if you're carrying the virus, COVID virus. This is a whole lot better than sticking something up your nose. If we could just have like a little microphone and we download an app, speaking to our phone, and it tells us if we have COVID or not. I mean, this is way better than sticking something up your nose. I prefer this any day. What sucks is the research is still in its early stages, but they're trying to develop an AI that could tell people whether they have coronavirus or not based on their voice. That would be awesome. Do away with the sticking up their nose or just nose in general. I hate those things. They're sadistic. I always thought they were sadistic. I'm not going to go into the development of how that was tested. I'm kind of annoyed just thinking about it. And can you imagine the worldwide possibilities, right? You don't have to ship a bunch of tests to all over the country or way out in the bush where somebody lives, right? Or in, out in the country or on a farm somewhere. They could just basically, if they had internet access or a phone, they could just get this app on their phone, download it, install it, or pick it up somewhere even, and install it on their phone and just, whatever, sing, yell, whatever they do in their phone to determine in their voice what they have. Now, a little tidbit. They wanted to give people some incentive to donate to this research. So a lab, Carnegie Mellon, the lab in Carnegie Mellon, they published a rough AI tool online that could predict whether people have a higher chance of being COVID-19 positive using their voice samples, right? It was already an online tool, but it did have a disclaimer, and they had to take it down in like 48 hours because they said that they could have run afoul of FDA guidelines and be misinterpreted by people's, regardless of the disclaimer, which I thought kind of sucked. I thought it was a good idea to put up, let everybody test. Just say it's a test, and just say it's something they're researching and not make any promises. I don't know what FDA guidelines they'd be breaking. They're just saying, people just saying hello on an app or hello to a screen. I have no idea. Anyway, I'm not going to get into the politics of that, but to me, I don't see the logic. Aside from maybe, some people would go crazy and start taking the concept wholesale and say, oh, you have COVID because you sound like this or because the machine said you did. It's just a test. I don't know. But yeah, there'd probably be some people crazy enough out there to run with it. They were running with things when we were going through the pandemic. So yeah, I guess I can kind of see. It's also been known to help detect post-traumatic stress disorder. I didn't know. There's more it can detect. Dementia as well. That's another one. I wonder, this library could just balloon into several diseases. You just basically test yourself at home by using this voice device, right? I really hope that the research can be developed and fleshed out really soon. This could save a lot of time, money, pain, just pain within testing. And I did a video a long time ago about telemedicine, basically medical, excuse me, I'm losing my train of thought. Medical diagnosis from a distance, or telemedicine, right? Or you even being treated from a distance, right? This is such an integral part of that, I think. And I keep looking, and the list just goes on and on. Maybe even certain types of cancer. I wouldn't be surprised if lung cancer was in here. That's obvious. Sometimes we can tell if some people have lung cancer just by the way they talk. It's not funny, but that's kind of obvious. I don't know if it is, but it isn't. In a lot of cases, looking at the warnings and commercials we've seen these days. But yeah, this is a really good technology to kind of delve into and kind of develop and make it more refined, and it could really enhance how we determine people's illness and how we treat it. I think this is a really big breakthrough, to be honest, And it's too bad we didn't come up with this earlier, just to save people a lot of headache and pain. And feel free to let me know your thoughts in the comments. And thank you so much for listening to me ramble on and on and on. And I appreciate your time. And please like and subscribe. Thank you very much.